Neuroprognostication post-cardiac arrest. Let me get sassy.
First things first, let's talk a little bit about the timeline. So in the first 72 hours, you're going to need a few tests to kind of help you give this patient and their family a prognosis. And so one will be a continuous EEG. Sometimes this is repeated at 12, 24, and 48 hours. Obviously, avoid sedation if we can, and the patient must be rewarmed at this point if they were cooled. We're going to get a CT head, an MRI if needed, and then the most important part here is going to be your clinical neuro exam. Now, once we hit the 72-hour mark, these are the things that give you a poor prognosis. If they have no withdrawal localization to pain, a malignant EEG pattern, which we'll talk about in a minute, and then no pupillary or corneal reflexes is highly associated with a poor prognosis, myoclonus, and then any imaging that shows severe anoxic brain injury. So the EEG is most important at 24 hours, and the background pattern is very important. If you have a continuous background, this is a good sign. This might look a little bit something like this, or your normal waves. Now, burst suppression is something that you hear a lot. It looks like this, a burst and a suppression, burst and a suppression. This is associated with a poor prognosis in 99% of patients. And if they're identical and the spikes are high, it's even worse. And then sometimes they'll have a completely flat EEG, which means zero brain activity. A quick note on imaging. So in the CT head, you are going to lose the gray-white differentiation. They can have edema, they can have herniation. And then similarly, in the MRI, you'll see a large degree of diffusion restrictions. Other testing that helps with neuroprognostication that is available at some institutions include somatosensory evoked potentials, where they stimulate your hand, for example, with electricity and then trace that nerve impulse back to the cortex of the brain. And if it fails to reach, then that's a bad prognostic sign. And finally, NSE is a blood test that can be used to measure brain injury post-arrest. If it's high, it's bad. I have not used this.